So I did my observation site hours at the Watertown Regional Medical Center, and the category in which I observed was orthopedics and sports medicine, and I had 4 different supervisors throughout it: Dr. Stockus, Dr. Frederick, Dr. Nelson, and Dr. Weddle. Dr. Stockus is a sports medicine medical assistant, and the tasks that I observed during the days that I observed and had observation hours was I came in and she was observing a patient before they went in to have a minor wrist surgery, and she was working on paperwork for the surgeon who was performing the surgery that day, getting like basic medical information and all that kind of stuff. And then the second supervisor that I observed was Dr. Frederick, and she took the x-rays for the patient who was having the wrist surgery and gave it to the surgeon and their team. When I observed it, I kind of took into account how she did the x-rays and what she used and how she did it, and what she kind of explained it throughout the time on how important it was to get the proper x-rays and stuff and give it to the doctor so they could do proper surgery. The third supervisor that I did was Dr. Nelson, and she's a sports medicine occupational therapist. And when I came in on March 17th to observe her, in the morning, Dr. Nelson worked with patients who were impaired, basically patients who had medical needs that were needing to be made. And most of the time it was people who had just gotten out of surgery, and she's teaching them how to properly bathe, put on clothes, and other important needs and stuff like that. In the afternoon hours, when I came in later that day, she was working with a patient who was rehabbing. She's working with the PT at the time, and he was just rehabbing and getting out of surgery a couple weeks ago. And that was basically all that I had observed. And the last supervisor that I had done on March 27th was Dr. Weddle, and she's a sports medicine nurse. And when I came in to observe hours, she educated the patient who was going into wrist surgery about like the risks and stuff that went with it, and answered questions and concerns that the patient had before surgery. And something that was like interesting with observing that was just how she replied to each of the questions, not giving him the answer that he wanted, but giving him the answer that would help him the most in his recovery time, and hopefully having him be confident that he can get back to his normal life after surgery, because wrist surgery is not really easy. I believe that he had something to do in like the construction field, which it's not easy to come back from when you have wrist surgery. One thing that I did like about observing was just getting overall look into how sports medicine physicians work with different careers in the hospital. And since this was a local hospital, it made it easy to go up and get observation hours and to get different fields of sports medicine physicians. And my aunt, she works with many of these people, and she was able to help me get in contact and talk with these different supervisors on what their job was like and all that kind of stuff, and help me learn different things. One thing that I definitely learned was how they work with patients before and after surgery, just how different they work with them and just the different things that they do. And I got to see how they go about, like in Dr. Nelson's case, how she went about answering questions for someone who's just going into surgery, and what kind of questions that she was being asked, as that was normally what questions I would have before I was going into surgery, and then after surgery too. So some things that I really didn't like throughout the time observing was just felt a bit odd sitting in and watching and listening to people who are in the hospital setting, because it's kind of odd though, just sitting in and listening to that kind of thing. But I mean, it was interesting listening to how they answered the questions, but just felt a little awkward sitting in and listening to the doctor and doctors and how they interacted with the patients. I wish I kind of had a little bit more time observing, kind of going in maybe 2 or 3 more times and getting a little bit extra observation hours. Just seeing the different protocols and patients that they came with, because the only time I really came in was only times I went in was when they were having just before surgery, and just seeing kind of that. I think that being a sports medicine nurse was going in and seeing, Dr. Weddle definitely made it more interesting seeing what a sports medicine nurse, because that seemed the most interesting and fun. I wouldn't say fun, but like most interesting to me. That'd be most likely the jobs that, if I were to pick between those 4, that'd be the most likely job I'd choose. But most of the time, I wouldn't say I'd want to be a sports medicine physician. I'd be wanting to do something in the strength and conditioning field. That'd be a bit more interesting to me, and doing more research will help me get more familiar with the sports medicine physician field and the strength and conditioning field, depending on which one I decide to choose.